series. This is our second webinar, and today's topic will focus on increasing access to income benefits. My name is Tanya Torno, and I am the manager for the Continuum of Care Division for Riverside County. I also have two members from our team, both Tiffany Nelson and Melanie Wilson, who are key players in helping us put together these workshops, and they are on the line helping us facilitate. I did want to make sure that all of our participants knew ahead of time that we are recording these webinars. They will be posted on our website. So we appreciate you as we move forward with this presentation. If you would please mute your phones or whatever device that you're using to participate today. As mentioned, these series are being hosted by our Continuum of Care Division and are designed to support local service providers with tools and resources to help you prevent and end homelessness in our county. I will start off by saying I know that when I first took on my job with the county 6 years ago, and I participated in my first Continuum of Care meeting, that I was just blown away by the large number of programs, right? The number of people that did the day-to-day work, the acronyms that are used. And so, keeping that in mind, we thought it would be helpful since we always have new programs starting up and we always have new people joining in on this work, whether it's supporting an emergency shelter, or you're part of a street outreach team, or you're providing direct housing services. It's always good to network and get a better understanding on what programs are available to help you make those successful linkages for your clients. So with that, we can go ahead. Tiffany, if you may jump over to the next slide. I'm going to provide you guys with an overview of what we have planned for you today. Tiffany, are you able to jump to the next slide?
Melanie.
Perfect. So we talked about the purpose. Again, just a reminder that the webinars are recorded, and we are always looking on securing speakers. So if you are interested in highlighting a program that you administer, we'd love to feature you, whether it's in our next series in November, December. Please email us at coc@rivco.org. And then the next slide will provide a breakdown of the agenda for today. So you'll see that I am already 1 minute over of this welcome. We will be hearing from Marcus Cannon, who is an administrator with Riverside County Behavioral Health, and he will be talking to us about the coordinated entry system. And then from 10:25 to 10:50, we have Luis Lopez, who is a program specialist with the Department of Public Social Services and directly supports the Housing and Disability Advocacy Program, which we refer to as Hdep. So they will both be giving a brief overview of those two programs, and then at the end we did save a couple of minutes for questions and answers, and we want to encourage you to type in your questions in the chat box. And so with that, we'll go ahead and get started. Marcus Cannon, if you're on the line, I'll go ahead and hand it off to you. Thank you for joining us.
Absolutely. Thank you, Tanya. If somebody could give me a thumbs up if you can hear me all right. Okay, good. Well, welcome. Thank you for that warm introduction. As Tanya said, my name is Marcus Cannon. I'm a Behavioral Health Services Administrator with RUHS Behavioral Health. And one of the programs that we're really proud of is our Coordinated Entry System. The acronym for that is CES. I know we've got a mixed crowd on today, so stop me or put a question in the chat if you have questions about an acronym that you don't know. What I'd like to do is just tell you a little bit about what coordinated entry is, how it can help you. I certainly don't want it to sound like a commercial for our coordinated entry, so what I want to talk about is a little bit about the way that our staff think about solving problems, and then hopefully that's helpful to you and your staff, and that you'll have that framework, as well as knowing that you can reach out to us if there's any way that we can help you. I know on the slide it says that I'll be co-presenting with Christine Shield, but unfortunately she had another commitment that came up this morning, so you're stuck with just me today. We call our coordinated entry system Home Connect, and fundamentally to me a lot of homelessness is about disconnection, and so our job is to try to remedy that with connection. That can be connection to family, connection to friends, connection to material resources, jobs, income programs, disability programs, subsidized housing. And that really is a huge part of our work, is making those connections and helping you all make connections, and helping consumers who are homeless or facing homelessness make connections. We operate a number of services through our Home Connect program. One is a 24/7 access line. The number I think is on a following slide. I know it's at the last slide, so you don't have to write this down if you don't know it. It will be up, and I'm sure we'll be sharing these PowerPoints out. The number is 800-498-8847, and that access line does a number of things. We take calls from agencies who are serving those who are homeless or low income, as we take calls as well from homeless consumers themselves. And in both cases, where staff are starting is thinking globally, thinking about kind of what are all the domains of this person's life, and how can we help connect them to resources in those different domains. And resources such as, you'll hear about in the next presentation about Hdep, which is a valuable resource for helping people with disabilities get connected to income. You can see our flyer here. This is a flyer that we distribute broadly. Pre-COVID, we attended a tremendous number of health fairs, community outreach meetings, community events, anywhere that really we could get the word out about what we do. We know that many people who are facing homelessness or who are homeless may be able to resolve that situation without long-term federal assistance programs, and colloquially what we call that is problem solving. So when people call, those are the initial conversations that our staff have, is to ask callers a little bit about who are you, where are you from, how'd you get here, and to look for pieces of their story where we can help connect them to resources, sort of the low-hanging fruit, so to speak. And so really what I would say about staff, what our staff are doing that's different than simply having a resource list, is they're acting as the bridge or the connector between what is an ever-changing network of resources in our county. And I think that that's the challenge as well for you and your staff, is to think about how do you help staff stay trained in such a way that they have a mental map of the resources, because a resource binder, even if it's electronic, in and of itself is static. And something that's amazing about the human brain is the way that it can build connections from two different pieces of information that are seemingly unrelated, but then to make that connection, and I'm not a mathematician, by any stretch of the imagination, but we know in our brain there's billions of these kinds of connections kind of running in every which way, and that's part of what allows our brain to solve problems in a way that it's very difficult for a computer to, is because our brain can take one piece of information and recognize a relationship to all sorts of other pieces of information that might seem unrelated, but are actually connected. And so in the same way, I think that's the challenge for staff, is to know the resources well enough that when someone calls in, that we hear their story at face value, but we're also kind of listening for the silence, or listening for the pauses, listening for the things that are unsaid that might give us clues about how else we could intervene in this person's situation to try to help them, again, get reconnected. Some of the practical things are, thinking about, do your staff know all the transportation programs, whether it's the Dial-A-Ride, the Lyft or the Uber that might be reimbursed by a health provider, local charities, local city organizations, local law enforcement agencies that will buy bus passes for individuals who need to get somewhere, bus ticket home program, knowing how to have a conversation with individuals about where is it that they've come from, and can we call together to talk to someone back home and try to repair a relationship, and if that's a resource of a place that you could return to, can we help get that travel paid? So those are examples of what I mean by problem solving that are outside of our long-term federally subsidized resources. But a lot of what we do is connecting to your agency. So part of our job is knowing what it is that you do and what you do well, and then making sure that we get people connected to the right place. And so I'm excited that we're going to hear from Luis in a little while to talk about Hdep. The bulk of our calls and emails that we receive are these types of diversion calls and problem solving calls. There's a great, well, the quality isn't great and that's on me, but there's a screenshot here that gives an example of sort of the types of questions that get asked. And so this is just one page of our screening form, but we start with safety questions to make sure that we're not missing something in terms of a domestic violence or other life-threatening situation. And then we start to learn more about the household. Are there children present? One, that's a safety thing. We want to make sure children are safe. But two, as soon as staff hear children, they should kind of have that part of their brain light up to think about what are all the children's resources? What are the housing support programs, the family stabilization programs through DPSS CalWorks, through the Housing Authority, through local family and children's providers? What are the olive crests and the respite care providers in my area? We want to know what city individuals are from. Oftentimes cities might have local assistance funds or locally funded programs in order to help residents. We want to know about how long they've been homeless. We want to know, are they a veteran? We're thinking about the Loma Linda Veterans Administration, the grant per diem programs, and the various temporary housing programs that are available to veterans. We know that we have an abundance of VASH vouchers. These are federally subsidized Section 8 vouchers earmarked just for veterans, and we have more than we are able to use currently in our county. So that's a great resource. So it's this type of problem solving that staff are doing with homeless consumers. However, and so what I would say is that the bulk of consumers can be helped that way. But for those who can't, then we start to think about how do we shift this from a phone service to an in-person service. And so oftentimes that's a referral to one of you all at a homeless shelter, at a community agency, at a feeding center, at a drop-in center, at a cooling center. But for those consumers who might have the most severe needs, consumers who are chronically homeless and might have physical health conditions, mental health conditions, substance use conditions, the next step is connecting them to an outreach provider. That might be a behavioral health outreach team, of which we have a number, but it may well be an outreach team through a community provider such as Path of Life, SWAG, CityNet. There are many others that I could list. And that outreach provider can then make contact with someone on the street and start to have a more in-depth conversation about how can they navigate that person to housing and how can they help with case management for that person. One of the services at that point that often gets provided is what's called a VI SPDAT. A VI SPDAT is a vulnerability index service prioritization decision assistance tool, which as you can see is why we have an acronym for that, because nobody would want to say that. But the basic idea is that this assessment measures acuity of someone's homeless situation. How likely are they to die or be at high risk because of their homelessness? And so staff, both our own staff as well as many of your agencies, are trained to conduct those VI SPDATs and then enter them electronically into the homeless management information system. And our team then takes that list and sorts it and looks again for opportunities based on people's characteristics, and then connects individuals, refers individuals to available housing vacancies. So many of our agencies within the continuum of care that are funded through HUD to provide rapid rehousing, transitional housing, ESG housing, permanent supportive housing programs they notify us whenever they have vacancies and they ask for referrals. Their programs might be designed to serve specific subpopulations, veterans, people with HIV or AIDS, people from a specific geographic region. And so we use that sorted list to then make the next appropriate referral, and then to provide any housing navigation that's needed to ensure that there's a warm handoff between the agency that's identified, this homeless person and is trying to get them connected to services, and the new agency that'll be providing the services. I know that's a lot of talking and a lot of acronyms, so I want to make sure that there's time for a few questions. But what I would say that's really most important to remember is that really is our role is again connection. We know that homelessness is caused by disconnection, disconnection from resources, disconnection from income, from jobs, from a place to stay. And so our staff are trained to try to make those new connections and do that organically in people's lives or by connecting them to service organizations like yours. We're happy to answer questions. The best way to reach us is there at our email address, homeconnected@ruhealth.org, or 800-498-8847. And I know our time is brief this morning, but we're happy to come out and provide trainings or in-services, get together with your staff and think about how can we do things better. That's part of our mission too. So I'm going to take a quick break and see if there's any questions. I do see in the chat a question that says, if a young adult calls CES for assistance, will they be connected with service providers that specialize in working in youth? Definitely. A couple of the service providers that come to mind for me, of course, are Operation Safe House and True Evolution. Other service providers that we would commonly connect youth to would be that there are a series of TAY drop-in centers operated by behavioral health. There's one in La Quinta, one in Paris, and one in Riverside. And I'll fully confess that I don't know all the resources as well as my staff do that are taking these calls 40 hours a week. But yes, we do have specialty youth providers in our county that we would try to connect them to. There's a follow-up question. Is there a process for individuals who receive referrals from CES to make sure that they don't get lost in the referral process? That's a great question. And what I would say is there's a gap there and an opportunity there. As CES, we're a small staff, and as you know, we've got a big county, over 7,000 square miles. So it's not remotely possible for us to individually stay in touch with every single person that's homeless in the county, several thousand folks. So again, part of our networking role is requesting and relying on your organizations to provide a follow-up to the people that you contact. That's why your data entry into HMIS, the Homeless Management Information System, is really valuable because you can enter a client in there that's in need, and then by ensuring that your staff are providing a service every 90 days, it keeps their name active and live in the system so that when we go to pull names, that list is up to date. We do on our own look at the top kind of percentage of the list and reach out to those people in advance to say, hey, you're close to the top of the list. You might be referred for a vacancy soon. Are you still in need? Try to make sure that we can ensure people have their vital documents, disability verified, chronic homelessness verified, if those are things that are going to be needed to make a referral. But we are not ourselves able to stay in touch with everyone. So it's definitely a partnership effort. There's a question from Karen Roper from the city of Corona. She says, if a city is in need of behavioral health in-field outreach support, what is the best way to coordinate outreach services? That's a good question. I think that there's multiple ways to do that. Certainly, if you're calling about a single individual, contacting Home Connect either by email or by phone is a great way to do that. If it's a city looking for sort of a bigger, more coordinated effort, that could be something I could help with directly. I can be reached through this email address. Staff will get it to me, but also my personal email is mcannon@ruhealth.org, and happy to have those conversations about how we could support a city in outreach services. One other thing I'll say about that is the Home Connect staff are trained to know about a number of the mobile behavioral health programs. We do have programs such as our crisis programs, where staff respond to 911 type situations with law enforcement, or they respond to these situations at emergency departments or at schools where people are in behavioral health crisis. We have a number of programs where we have a clinician, a licensed social worker, who rides along with sworn law enforcement personnel. That'd be another example of a mobile program we provide. So that's another service that the staff provide, is kind of hearing what's the particular situation and trying to think of which of the behavioral health mobile programs would be best able to meet the need. There's a question here, so what is the easiest way for a provider to refer a client to your program? Certainly you can give them our phone number or our email. The warm handoff is always best. We find that if you're the provider and you can call with your client there in the room and call us and say, hey, I've got Marcus here in my office. He's homeless. He came in asking for help. Can you give us some ideas about where we might start? Sometimes that's the most productive conversation. We know that our homeless consumers oftentimes might lose phones or change phone numbers. So if we're only getting their telephone number, sometimes it can be hard to track back and stay in touch with them. There's a question here. It says 211 Riverside would like to invite a CES liaison to conduct a presentation for our community resource advisors. Who would be my point of contact? Belen, if you would just reach out to me on that one, I will put my email address here in the chat if I can do more than 2 or 3 things at once. But it is mcannon@ruhealth.org, and we can arrange that. There's another question here. Can clients walk into a behavioral health office and request these services? Yes, clients can walk into a behavioral health office, and they could certainly say that they're homeless. Our outpatient clinics that are scattered throughout the county, their first and foremost specialty is providing clinical behavioral health services, counseling, substance use services, psychiatry, medication. But all those clinics have peer support specialists on staff and behavioral health specialists on staff who have training in case management to think kind of big picture. And we do our best to advertise internally within our department to make sure that they know about us, so that if they have a homeless consumer walk into any clinic office, from Corona to Blythe to Temecula, that they should either have some sense of how to start helping that consumer or get the consumer in touch with us, and then we can provide some of the more specialized homeless services. I don't see any other questions in the chat. Tanya, I think I'll turn it back over to you. But again, folks have our contact information now, so please don't hesitate to reach out and let us know how we can help. And if we're doing something good, we'd love to know that. But if there's something that you see that we can improve, then we want to hear that too. So thanks for having me this morning, and I look forward to serving you however we can.
Thank you, Marcus. We really appreciate all that you and your team do to support both providers and clients. I can't say enough. I know that the Continuum of Care has a great sense of appreciation, the Housing Authority as well. You guys have stepped in to assist on multiple projects on multiple occasions, and just having knowing that your 24-hour hotline is available has been such a great resource. So we appreciate you taking the time to join us today. We are going to jump over to hear from our second speaker, which is also, I think, a very special contact for us. Luis Lopez is the program specialist over the Housing and Disability Advocacy Program, which again we refer to as Hdep. We love our acronyms, and that program helps individuals who are disabled and experiencing homelessness connect with Social Security benefits that they need in order to many times sustain their housing. Luis is special to us because he was part of the Continuum of Care team for a very long time, and also helped support the point-in-time count planning efforts specifically for youth. So you may have sat in a workshop or training with him when those events were planned. So with that, Luis, I'll go ahead and hand it over to you. Thank you for joining us.
Thank you, Tanya, and thank you, Marcus. Good morning to everybody. As Tanya mentioned, I'm with the Department of Public Social Services. Excited to be with the program, and I know how important it is to the community to be able to connect some of our consumers with income. And, it's been a privilege to be able to work alongside with a lot of the other service providers within Riverside County to be able to make this happen. The Hdep program is a newer program, so we are trying to still mainstream it within the county of Riverside, and looking forward to partner with other service providers that aren't aware of our services to see how we can assist some of those individuals in attaining their income benefits through the Social Security Administration. Next slide, please. So as Tanya mentioned, the main programmatic goal for Hdep is to assist individuals who are experiencing homelessness apply for disability benefits, while also providing housing assistance for those that are eligible. The Hdep program was established back in 2016 by the state. So DPSS has been applying for additional funding, and we were recently awarded that additional funding to be able to continue assisting those individuals that we have on our caseload and any new referrals that are coming our way. Next slide, please. Why is Hdep needed? For individuals who have disabilities and experiencing homelessness, we know and understand that navigating the SSI and SSDI application process can be extremely challenging. A lot of the times they don't have a mailing location, they don't have a telephone, so it becomes very challenging, and there's a lot of barriers that exist when they go to apply, or they don't understand a lot of the documentation that's being sent their way or presented to them. So, what we try to do is help them obtain some of the records. We know sometimes there's a lack of identification and other forms of documentation. We do assist in attaining some of those documents to be able to move forward with that Social Security disability application. And we know and understand that although they may, a lot of the homeless individuals in our community may be eligible, their inability to document their disability and apply for these benefits is typically a major barrier to receiving them. Next slide, please. So what we've tried to do with our Hdep program is try to work with a lot of the service providers in our community. We know and understand that some of their staff is SSI and SSDI Outreach, Access, and Recovery certified. And we know that that's a long process. So what we try to do is assist them with that and lessening the burden for their staff, so that way they have the time, to be able to take on other roles and responsibilities. As I mentioned, our main programmatic goal is to assist with the application process, so that way it helps the participant increase their income. So that way, they can provide some stability. We know sometimes that that's a huge barrier for them moving forward. Also, we know that some of the housing providers can improve their program outcomes by helping their participants increase their total income. And we know that sometimes that is a huge plus for some of the service providers as well. And not only that, increasing the benefits for their participants. Hdep eligibility. So this is typically for individuals who are disabled or likely disabled, who are experiencing homelessness, and we use the HUD definition. The highest priority is given to those chronically homeless individuals and those who rely most heavily on state and county funded services. And so individuals who are already receiving disability benefits and or have stable housing are not eligible to Hdep. Next slide, please. The Hdep application process. The process to access Hdep services can be through a referral from Home Connect, Project Room Key, CoC service providers, and DPSS departments. As I mentioned earlier, we're always looking to add new, service providers and community partners, as we are a small team, and as Marcus mentioned earlier, Riverside County is pretty large. So my contact information will be shared here shortly. So anybody interested in either referring an applicant or, requesting additional information about the Hdep program, you'll be able to reach out to me. Prior to an Hdep staff completing an Hdep application, the consumer must first pass the screening outlined by the Housing and Disability Advocacy Program. We've realized that, we would receive a huge packet for an individual or consumer within the community, and we would find out that they weren't eligible for our services. So we developed a screening tool to be able to prevent that completion of that that complete packet, which is at times very lengthy, depending on their disability and their needs. So on top of all the other forms that are typically completed within the scope of the program, we're just trying to minimize the effort on the staff and the burden on the applicant as well. The screening tool determines whether or not Hdep staff can proceed with Hdep application and enrollment. Once again, please do not submit an application for those individuals who do not pass the screening. If you have any questions, feel free to reach out to me. We know and understand sometimes there's these questions that may arise that aren't typically on our screening tool or even on our application. So I'm here to try to facilitate that process. Effective referrals. Once an Hdep application and screening tool is completed, please submit to myself, the Hdep coordinator. My contact information is here. We did get a new email recently, which is dpss hdep@rivco.org. Feel free to reach out to me on either my main or cell number. I am telecommuting, but try to make my best effort to answer any of the calls and questions that arise. If a referred participant meets our eligibility criteria, we'll go ahead and reach out to complete a program enrollment over the phone. We currently, due to COVID, we aren't doing any face-to-face interaction, but we are we're very willing to complete a program enrollment directly over the phone. We try to work with some of the service providers as well as the participants to be able to facilitate that. Next slide, please. So Hdep has 4 core components. It has outreach and referrals, case management, housing, and benefits advocacy. Next slide, please. For outreach and case management services, we typically rely and work with the service providers within the community to be able to take on that needed case management, such as wraparound services. Our main focus is to advocate for the client on the Social Security Administration side for the disability benefits. Typically, the case management is for the length of the time that the Hdep services are being provided to the participant, and until the client is transitioned to permanent housing with case management and a supportive services component. Next slide, please. So for the disability income advocacy services, we do work with an contracted advocate. They take on these cases and they provide the advocacy services from start to finish. So they assist with the full application of the Social Security disability application. If there's a denial, we will assist with an appeal. We work with the service provider as well as the client to attain maybe additional documentation that wasn't presented initially, especially if it's like an ongoing disability. For the client, we like to attain, the medical records to be able to present, new and updated information to the Social Security Administration. We also assist with obtaining all relevant documentation from hospitals, medical centers, clinics, employers, case managers, and others to meet the necessary burden of proof of a client's disability to submit a stronger application to the Social Security Administration. Next slide, please. For our housing, we typically provide housing for those that are prioritized through the coordinated entry system, who have a home connect for either permanent supportive housing, rapid rehousing, Section 8. So participants that are not served by the Hdep interim housing assistance but need housing services, we work to link them to some of the other service providers within our community, so that way there's a form of housing that is presented to them. The length of stay within our housing varies. Sometimes a lot of these clients transition into permanent housing, rapid rehousing, faster, which enables us to provide additional assistance to other clients within our community. And our housing is typically in the form of, hotel voucher or room and board, and a couple other housing service providers within our community. So, next slide, please. Once a participant is approved for Hdep services, they'll remain eligible for continued advocacy and housing assistance until both the application process for the disability benefits is complete, whether that's approved or denied, with no appeals left, and they are stably housed in some form of housing. Suppose a program participant decides not to pursue an application for disability benefits, we will then work with the referring service provider to help them transition into some of our resources within our community. I do see our question. Our Hdep participants typically, I apologize, something popped up. Assisted with bridge housing while waiting for permanent housing. As I mentioned earlier, we do assist with bridge housing, but it's only for those that are eligible, typically who have been issued a home connection. We are looking to, during our next application, we'd like to do a 1-for-1. So any client we take on for the advocacy portion, we'd like to provide that housing because we know how important that is, as well as for the service provider and our advocate, who at times, when a client is homeless within our community, we do have to work with outreach, personnel and law enforcement and other service providers to be able to locate them, and sometimes it does delay the application process. So we'd like to try to facilitate, by housing them, as soon as possible, so that way we can have that constant communication going. So next slide, please. Once again, I am the Hdep coordinator. Please feel free to reach out to me with any questions you may have regarding our services, the application process, eligibility, or even some kind of training for maybe you or your staff. I'm more willing to assist in any way that I can. So please feel free to reach out to me.
Thank you, Luis.
You're welcome. I do see another question. So we do assist in other capacities for those that need applying for Social Security disability benefits. Typically, it would be your supplemental security income, so SSI, and then your SSDI as well. So we do apply for both when we apply for these benefits. A lot of times we've realized that some of the consumers or individuals applying for our services don't have enough work credits, so we'll typically just move forward with SSI. It's the easiest way for a provider to refer a client to your program. It would be via email. To the email that was provided earlier. That would be the quickest way. Typically what I'll do is I'll either ask additional information if, screening form or an application hasn't been provided, and then just provide any kind of answers to some of the questions the individual being referred, might have. Great. I don't see any other questions, and like I said, I'm here to try to assist, so please feel free to reach out to me. Thank you.
Excellent. Thank you, Luis. We appreciate you. For everyone that's on the line, I know that both Luis and Marcus provided their contact information. I just wanted to let you know it is also, actually it's not, I thought it was on the flyer that we provided, but if you do have any follow-up questions, again, we did include their email, their contact information in the chat box, but you can also send over any questions after this webinar ends to coc@rivco.org. So with that, we had actually saved some time at the end for questions, but since each speaker reserved some time at the end of their presentation for questions, it may be that we have them all answered. So before we completely sign off, though, I just wanted to, again, thank you for your participation. I also wanted to make a special note. I was looking at our list of participants and noticed that we had Sunday sales from Supervisor Washington's office as one of our participants. And I have to share a story because it was literally 2 years ago that Sunday and I were part of a meeting with local emergency shelters. I think CVRM had someone there, Valley Restart, and Path of Life, and we met in Beaumont at Liberty Village, which is a housing project for veterans and their families. And after that meeting, you have those parking lot conversations, and it was there that she introduced the idea of, wouldn't it be very cool if we could set up some type of webinar training so that as we have new programs, or even just to highlight existing programs, we could invite agencies to speak. And I so appreciate that she expressed that need. I recognize that was 2 years ago. We've certainly had a lot happen since then, but I think that is important to share because you'll often hear us say, if you have any suggestions, any ideas, please share them with us. And so I want to encourage you to do that, whether it's following up with Tiffany Nelson, Melanie Wilson, or myself, again, at the email address provided or directly to us. Know that we truly take your feedback into consideration, and we want to make sure that we can do our best to support you, so that we can better support our clients, so that right there, either we can prevent them from entering homelessness, or the time that they spend on the streets or even an emergency shelter can be reduced because we can make those linkages to services and housing. So thank you again for your participation. With that, we'll go ahead and sign off. Stay safe, stay healthy, and we will see you soon. Thank you.